Hello, everybody. I'm Amy Armstrong. Today, I have with me Ashlee Rowland, and we're going to delve into Ashlee's journey with the RCP. And it's quite a fascinating journey of healing for Ashlee. She's shared her journey quite publicly with tens of thousands of people now on your Instagram page. And yeah, it's quite the story. So hello, Ashlee. Thanks for joining us.
Hi, thanks for having me.
So take us back and share a little bit about your health and your symptoms and I guess your diagnosis prior to finding the magic of minerals and I guess really, real healing in general.
Absolutely. So I, like a lot of people that are probably listening to this, went through the whole laundry list of, different elimination diets and different methods of trying to heal because I knew that something wasn't, going right with my health, but I wasn't quite able to figure out what that was. And I did AIP, keto, paleo, fasting, low carb, like lemonade fast, all sorts of things. Because just as a teenager, I was 14 to 16 when I was diagnosed with rheumatoid arthritis, Hashimotos, celiac, and I had a ton of other things like Osgood-Schlatter's and bursitis and bone spurs in my hip that were cutting open my bursa sac in the hip, and horrible acne. I was put on birth control, PCOS, unexplained infertility. I was a kid going through all of this and just really struggling at, okay, what's going on? I'm doing quote unquote everything right, but I'm still struggling with my health. And I can't figure out what's wrong. I'm eating everything organic. Like I was eating pretty exceptionally. And even to a point of like being extremist, so, go through that orthorexic kind of state of obsession with clean food and just really wanting to really be in control of what I'm putting in my body so I could make sure that I could get better, but I wasn't. And so, obviously switching from a standard American diet, which is how I was raised, very standard American diet, to eating organic and whatever, some of the symptoms did go away, but the main things and the hormone imbalance didn't go away. And I could not get to the root of specifically the postmenopausal levels of progesterone I had as a 19-year-old. And so, I've tried everything, or so I think, and I'm just doing it all. Like I stick with it because in my mind, it seems right to eat nourishing food and to eat organic and to, avoid processed foods and chemicals in the home and stuff like that, even if I wasn't healing. Like it just seemed right. So I stuck with that, luckily. And then I was, me and my husband had been trying to get pregnant for 4 years. And so 4 years of infertility I was 24 at that point. Like I'm a young kid. I should be fertile and, I'm in childbearing age. It should be easy. This should be great. Yeah. And I couldn't figure out what was going on. And then it was shortly after that the PCOS onset. And then I had a bunch of ruptured ovarian cysts that left me just passed out and fell off the toilet because I thought I had to pee, and just passed out from the pain of the cysts rupturing. Went into the ER reluctant. My husband wanted me to go in because he was like freaked out because I turned all, looking like a corpse. And I was like, no, this is what's happening. I'm like explaining the physiological process going on as I'm passing out. And, I just paid a hefty medical bill for them to give me fluid, and tell me nothing. So still confused. What's going on if I'm doing everything right? Now I have PCOS. Like this doesn't really make sense. I still am not pregnant, wasn't ovulating. And then a friend of mine, Dr. Leland Stillman, who's actually gone through the RCP as well. He was like, you know what? He's also my doctor. So he's like, okay, you need to try the RCP. And I'm like, sure, I've tried everything else. So why not? So I just jump right in. I see liver on the thing. So I just go to natural grocers and buy a pound of organic grass-fed liver. And I cook up the whole pound and I eat it all in one day because I didn't know. I'm like, sure, whatever.
Nothing kind of girl.
Yeah. I get the bee pollen, scoop like a full tablespoon, having total histamine reactions, but I'm like, I don't care. So I stuck with the RCP. I learned about minerals, and on that whole health journey over the last like 8 years, I knew about magnesium, I knew about minerals and water to an extent, but I never really focused on minerals. And so that's what this whole handbook, like the RCP handbook was talking about, was the minerals and the diatomaceous earth, and, just really breaking down the nuances of that. And it wasn't 2 months later. So I had my cyst rupture. I called Leland. We got me on the RCP, and 2 months later, I got a positive pregnancy test after 4 years of unexplained infertility. So, it wasn't very unexplained. I had a mineral imbalance and mineral dysregulation, amongst other issues, that the RCP talks about. And it was like, truly, I say my son is an RCP baby, because that wasn't a coincidence. Like, I had been doing everything else except for the mineral part, up until that point. And so I had a wonderful pregnancy. I loved being pregnant. Like, I had a little bit of restless legs that went away once I got my minerals up. And then I had like a little bit of, a lower back discomfort, but I would go and get adjusted. But great pregnancy, wonderful labor, extremely healthy baby. Like, he's incredibly healthy and thriving and strong, and doesn't have, the normal, or I say normal, but common symptoms that a lot of babies have, like spitting up and colic and cradle cap and bumpy skin, rosy cheeks, all of that. He doesn't have that.
Yeah.
Because he's mineralized. And so that was all, I always thank Morley for creating this program, just for uncovering decades and decades, or even centuries of research that have just been kind of covered, so I could get pregnant and be healthy now, and be the truly healthiest that I've been. And my husband always is like, this is right. Like, out of all the things we did, the bulletproof, the whatever dumb things we did, this is right. It's not restrictive, it's nourishment. And like, we just feel good. So it's really cool.
Yeah. And it is, it's, it's based on, which Morley says all the time, it's based on Mother Nature. It's based on those foundational nutrients that obviously, and you're a poster child for this, really, is that you were doing all the right things dietary wise, and still there was gaps and imbalances and dysregulation there. And we know that our soil is not what it once was, 100, 200 years ago, that it is really deplete, and perhaps there is nutrients that we're not going to get all we need from our food. And I guess that's really important. A really important thing to know about the RCPs. It's based on what we should be getting minerally. So tell us a little bit more about about your health after pregnancy. So you're quite new to the RCP when you fell pregnant, which is amazing that you saw results like that. And I probably should add at this point for the people watching, how Ashlee did it, like, everything at once is probably not the way that we would recommend that people take on the RCP. It is kind of the tortoise wins the race to some extent. It's slow. Doesn't mean you see results slowly. Sometimes you see healing quite quick, but that real healing, that takes months and years to get to. So after your pregnancy, how did you recover from that, and what have you seen in your own health since?
Yeah, I love that you brought that up. So I always tell my clients now, like, don't do what I did. Like, if I say 1 granule of bee pollen, that's actually what I mean. Yeah. And so, a lot of times people that are attracted to this are more of the, go-getters, type A, and they just want to do it all. And so I don't recommend that. And so now to your question. So after I gave birth, I was actually, since I was new to the RCP, I had only gotten to really mineralize my body for 2 months, which is not very long. So just as a disclaimer, like, for women who are trying to get pregnant, I normally recommend, sometimes people are like really, really like, I want to be pregnant now. And I'm like, okay, you need to wait at least 6 months, but ideally it would be a year to 2 years of remineralizing the body. So all I got was 2 months to remineralize, or not even remineralize, to put some minerals into my body. And that made it to where, you know, I had a little bit of like morning sickness in the beginning, but nothing compared to how it would have been, I believe, if I wouldn't have even had those 2 months to have the healthy pregnancy. But then after giving that baby, you know, the copper dump and the download of all of my minerals, after I gave birth for 2 weeks, I was stuck in my bed. Because I was so depleted of the minerals, because I really didn't have enough time to get myself mineralized enough to, you know, take care of myself and take care of the baby. And your body's going to give everything to the baby. That's just the way that God designed us. And so 2 weeks after, baby's doing great. He has all my copper that I probably had in my whole body, all the rest of my minerals. And my midwife's like, can't figure out what's going on. I definitely wasn't anemic, you know, by what we explain that as, but my hemoglobin was slightly low to what she was saying. But I was like, I'm not taking an iron tincture, but I was also desperate. So luckily my midwife's very like-minded, and she's like, we're going to get you iron. And I'm just like, oh my gosh, like I can't take this, but whatever, bring it over. So she brings it over, and it's a iron tincture, but it's not actually, it's an herbal tincture that's dandelion, which is high in iron, but it's extremely high in copper. And so I was explaining this to Morley, and he was trying to figure out like, okay, what happened? What went on here? Did you lose a lot of blood? No, I hardly lost any blood. Actually, my midwife was like, whoa, you hardly lost any blood. And so it wasn't a blood loss issue. It was a copper issue. And so once I started getting in that dandelion tincture, and I was drinking like a tea with chlorophyll in it. And as soon as I did that, like my color was coming back. I was able to leave the house, you know, stuff like that. Cause I couldn't even get up and walk to the bathroom without an extreme, you know, like sense of going to pass out. And so I would just lay in my bed and sing to my child and like try not to pass out. And so this is why I always tell people, you need to get your body ready for baby and really spend the time remineralizing so you don't have to go through that. And like, I can confidently say that that won't happen to me again. People always say, well, that's naive to say, like, you can't control whatever. But if you're mineralized and you have mineral stores in your body, it's not going to happen to you. There's always, you know, emergencies, but like you can confidently say that. And that's something that I always encourage my followers and clients is like, why expect a standard American pregnancy or labor or, you know, postpartum if you're not living a standard American lifestyle? Like you can be confident in the fact that you're not going to experience that same, you know, negative effect that a lot of those foods have on us.
And I do remember hearing, I'm not sure if Morley said it, but somewhere along the line that really our body needs 3 to 4 years of you know, remineralizing, particularly between pregnancies, which most of us don't give ourselves time. You know, a lot of women will go, you know, have 2 or like myself, like 3 kids in 3 or 4 years, and it really doesn't give your body time to remineralize before you know, you're then passing those minerals on to your baby. So that's fantastic to hear that that you're able to get over that hump. And then how's it been since?
Great. So it was really cool. Basically, once I got those minerals back up in my body strategically, just like, it was crazy. I tell people I got healthier while I was pregnant. So I just posted on my Instagram, actually, videos of maybe like when I was freshly pregnant, maybe I was like 20 weeks pregnant. And so I still had, so something that I always struggled with my health journey was just like this puffiness. So water retention in the body, and my arms are always puffy. My face was kind of puffy, but mostly in my arms. And I remember after I had my baby, I hadn't seen my legs for several months, you know, because of my stomach. And I looked down and I was like, oh my gosh, like my legs look awesome. Like I look so fit. Like what's happening? And then I remember looking at my arms, looking at my face, and all of this water retention was gone. And I think it had to do with being like an estrogen dump, but then also the body feeling safe enough to rid all of the stored iron and all the, high amounts of polyunsaturated fatty acids that have been oxidized and stored away in the fatty tissues and estrogen and things like that. And like, since then, it's just been uphill. Like, I still, my baby's 17 months old, and he eats food. Like, he loves beef and oysters. And it's like, I'm like, oh my gosh, you are my child. I love this. But he mostly nurses still, and he's 28 pounds. And so like, I have a hard time keeping up on the minerals, but as long as I stay on it and, like everything is like eating for mineral density. So today I make a smoothie, and the base of it, instead of water, is like a sun tea that I made, for more minerals. And then I probably have 4 adrenal cocktails a day. And I mean, like, when you're nursing and active, like, you have to really focus on remineralizing. And if I do that, which I have, for the last now year and a half, I feel amazing. My energy is incredible. My skin is great. My hair is like crazy. I call it my HTMA hairs from when I've cut it at the scalp to send in the HTMAs. And now, I did it like 3 months ago, and the hair growth is just like crazy, and the skin, and, it's just, each day is like some other symptom that I didn't even know I had goes away. And, dental health and eyebrows growing back in from the Hashimotos, and just hair thickening, like I said, not as dry of skin. Like, we live in the Pacific Northwest. And so in the winter, our skin would always just like crack and bleed, and it was so dry. And I remember last winter, me and my husband were both like, oh my gosh, like, we didn't have to use any tallow or anything. Like, our skin was just saturated, and doing great. And so I always just encourage people, like, as you said, a lot of times you'll see the healing happen pretty fast, but there will be some things that take longer to go away. But some of them will come right away. And if anything, I mean, like, it takes a long time to get all this extra iron out of the body, and the supplemental vitamin D, hormone D, and to get these minerals, because you can take the minerals, but like, are your cells uptaking them? Are you utilizing them properly? So you just have to be patient with yourself, because people just feel like they're broken, and then they're like, well, this isn't working, this sucks. And it's frustrating. They have histamine responses, but stick with it. It's amazing.
Yeah. And I always like to explain it to people too. It's a bit like your body has an economy, it dictates where your minerals are going to go, where it thinks you need your minerals, not where you think you need your minerals.
I love that.
Feeling, but so that it can take time to, I always kind of get this image of just filling from the toes up. You've got to saturate your tissues like right to the very top for to see that real deep kind of healing, where you just know that you're not just masking those symptoms with good energy production, but actually they're actually going away. So yeah, it can take time.
I love that.
Transition us now to at what point you kind of decided that you might like to go and formally study the RCP with Morley at the Institute, and how you've kind of incorporated that into your life professionally now. Yeah.
So the RCP, they have their handbook and all their great resources, but they also have the Institute. So I had seen it, I think maybe a couple months before, but enrollment was closed and I couldn't wait. And so then I decided, like, I'm going to enroll right after my baby's born. So I had a newborn and I was like, whoa, this is crazy, but it was amazing. So I'm a holistic nutritionist. So I work with clients, and I knew that I wanted these tools because I had a lot of things like, I want to know how to, read the HTMA. I want to know more about minerals. It was all new to me. Like, this was a brand new thing to me. And now all these people are like wondering what happened to me, how I finally got pregnant after all these years. They've been following this infertility journey. So I enrolled and was so excited, and just the information is absolutely invaluable, and it's hard work. It's a lot of hard work, and it's you have to prioritize the time and do it. But if you do, you will get so much amazing information out of it. And I knew that that was just an extra tool that I wanted, to have that RCPC. So people know, like, okay, she's trained in minerals, that's really helpful, because a lot of people come to me, well, what do we do about this symptom? Or what do we do about that symptom? And I had been on that, like, no symptom chasing thing for a while anyways, because I chased symptoms for so long and it got me nowhere. And so when Morley was always like, no, like, we're focusing on the whole system. It doesn't matter about the symptom. And just like hearing that over and over again, it helped me to have that confidence to my clients. They're like, well, what about this? And what about that? I'm like, it doesn't matter. Like, yeah, we're taking note of those things. Those are signals from the body, but we're still going to work on your whole body from the cells up, like you said, from the toes all the way up. Because if you do that, every single base is going to get covered. And so in the training, it was really cool. One, the knowledge, the information that was shared. And then two, all the other people that we've gotten to meet and that we're now like Instagram friends with, and, making connections and just kind of taking over this little space on the social media apps to really help people and to actually see these people healing themselves. We're not healing anyone. Like, they just make these small changes. They add minerals and all these symptoms are going away. And so I knew I wanted to get in on that. I knew I just had to jump in, add it, to my resources. And if people are, hesitant on should I or should I not, like, there's so many great resources beyond the physical knowledge of minerals and copper and body mechanisms and stuff like that, like teaching you how to establish a business and actually work with people. And they help you with pricing and all of that, like if you have questions. So it's just a great overall tool for anyone, even if they're not a practitioner, just to learn about all of the things that the media and like propaganda has pushed down that they don't want us knowing about, because it's the true healer, because it's nature, like it's all in nature. So it's really, really great.
Yeah, there's no money in nature, unfortunately.
Yeah, can't patent it.
Yeah, and I think you've touched on an important point there, Ashlee, that I don't think anybody else has yet, which is that the business side of the RCP, and if you're wanting to go down that route. I mean, we know a lot of people just come and do the formal training for themselves and their families, but for some of us, and I say us because that was my case, we find that there's a little niche there for us to actually start to really have a ripple effect and helping people. But when you go in and you have all this knowledge, there's a whole other side to helping people, and that is, setting yourself up for a business, setting up your technology, your social media, your website, if you want to do that. I mean, you don't have to do any of it, but if you want to do it, there really is now this part of the RCP and part of the community where you can really find help to do those things. And that's probably important for people to know, that there's help with the business side as well. So you were obviously established before you came into the RCP.
Yeah, so that was cool to be able to help, because it's overwhelming, especially, I mean, I don't know what I am, Gen X, millennial, I'm something, I'm 26. So, being able, I grew up in this, so being able to help people set up a quick website, or just how do you even create an Instagram, or what's a good pricing, it's just, they'll walk you through it. So it doesn't have to seem so overwhelming.
Absolutely. So when you come into the community, if you choose to be part of the alumni community, there's an amazing website there with so many resources. And not only that, just help within the community. And I'm sure you've had a similar experience, Ashlee, just in terms of the connections you make with people all over the world. It's pretty amazing that you can tap into different people, different practitioners who come in, and all their skills along with it. So I found that to be really valuable as well. So I guess, really just to wrap it up, my question for you is, how has this changed your life? The RCP, going on to study, what has it done? How's it changed your trajectory?
So it's entirely changed it, because I went from having a private practice of clients who were getting better, but then always getting stuck somewhere, because most of them were coming to me as more complicated cases that have been dismissed by doctors. And so I'm like, okay, we'll do this, this, this. But then when I would get someone that's doing this, this, and this, and they're still stuck, I was like, okay, well, I don't know.
Piece to this puzzle.
Yeah. Yeah. So it's just been great to now see clients graduate, that they don't need to see me anymore. And that's my goal. I don't want to work with people all the time for the rest of their lives. And we'll do check-ins maybe once a year if they want, or, we become friends or whatever. But it's changed that perspective, like, of my practice. And then for my own life, like, we're healthy, and people see it. So now people, what did you do? Like, I watched you for all these years do all these things, and I wasn't really sold, but now, like, what did you do? And so just, my inner circle, and then that ripples out as well. So it's just like, I wish it was basic knowledge that was taught, in school to kids, and like, we'll be able to homeschool and teach our kids these things, but it just completely changes your life, because it brings you back. And my whole business is always about nature. Like, I've always just been obsessed with nature and like simplicity and seasonal. And so it's really brought me back, because I was still grounded, but I was like a little kite flailing all around. I still knew where I needed to be, but I was just so confused. I couldn't heal. And so now I'm kind of back down, grounded, and like, no, this is the truth. And it really, I'm always willing to learn. I don't know everything. So I'm not saying that I can't be shaken in that sense, but like, there are truths now that fundamentally cannot be shaken. So like, if people are like, well, what about that? And what about this? And well, that can't happen. I'm like, well, it can, because I did it. Like, people have a really hard time swallowing that I've cured incurable autoimmune diseases. Like, it just really grinds people's gears. And I really like to just keep doing it, because I'm giving people hope. I'm not just telling everyone like, oh, well, if you have like Hashimoto's, just get off your medication. Like, I am absolutely not saying that. I'm saying, maybe you should continue to research and try these different things. And I don't know, maybe you can get off of your medication, because I've had, several tens, 20, 30 people do it. Not for me, but for them. And they're told they can't. And so, it like rekindles your like grounding to nature, and that you can heal, and that you don't have to be a slave like to the medical establishment and to like fake news and different things like that people are stuck in.
Yeah. And it's a really, really, the natural health world's a really noisy market at the moment. There's
oh my gosh,
so much information and so much noise. And what I love about the RCP is it is so simple, and it is foundational minerals that we should be getting, that, biologically, physiologically, our bodies need to function. Let's just bring it back and give out these foundational minerals. And I think when people, I don't know about you, when people first come to me, that's one of the comments that I get often is, wow, this is so simple,
And it's like hard to believe.
Yeah.
They're like, okay, but what else? Like, what else are we going to do?
Yeah. So there's always the what else.
That's because like in all the noise you're talking about in my course, that's literally the entire reason I created my course. It's called Quieting the Noise of the Wellness World, because it's so much that you can't even think straight. And so then when you get something just simple, people are like, no way.
Yeah. And that's where that phrase that Christine coined, the simplicity and the enormity, I think that just sums it up really well.
Yeah.
Well, thank you so much, Ashlee, for sitting with me today and chatting about your journey. And I'm sure that people will get a lot out of hearing it. And I think the main takeaway from your pretty fascinating journey is hope.
Yes, absolutely. Thanks for having me.
Yeah, thank you.